In the next few minutes, we'd like to give you some general information about our training program. More specific details will be found in another video that will also be located later on this site. The entrance requirements for our training program is that you have graduated from a U.S. or Canadian dental school and you must be a U.S. citizen or a legal alien. Ours is a 6-year training program and we accept 3 residents annually. You will receive education in oral and maxillofacial surgery, for which you will receive a certificate of training. In addition, you will receive a medical degree as well as 1 postgraduate year of medical education that you can use for medical licensure. We have a very busy and vital training program that more than fulfills the essentials of accreditation standards set forth by the Commission on Dental Accreditation. In addition, we have 10 dedicated surgical faculty with diverse backgrounds and interests.
I looked at the cases that were presented to me. I said, oh my gosh, I wish I had trained where I'm now on faculty. Our residents have the experience to handle every one of those cases. And they don't just talk about it because they've read about it. They talk about it because they do it, and they do it regularly. As the clinical director for oral and maxillofacial surgery, one of the highest priorities for me is making sure our residents are safe. Whether that's with the COVID-19 response or just in general. We're going to make sure that what we're providing to our patients and to our faculty and our residents is nothing less than the best possible environment that one can render dental care or oral maxillofacial surgery care. When it comes to the COVID response, we have done an exceptional job making sure that we are giving our patients, our residents, our faculty and staff the safest environment to operate that they can.
The relationship with the attendings here is one of ease, I would say, primarily. Most of our attendings have open door policies. It's really easy to go talk to all of our attendings. Anytime I feel like I'm uncomfortable with a treatment decision I'm making or a consult decision I'm making, I have no qualms about going and talking to my attending and asking them what their opinion is, what their experience is, and pulling from them in that way. Because without being able to do that, how can we really become competent oral and maxillofacial surgeons ourselves? We cover significant amounts of orthognathic surgery, significant amounts of dental alveolar surgery. We get a hefty amount of trauma call, and we also have a cleft and craniofacial trained surgeon here. And so we get a lot of the fellowship trained experiences that other places would get with a fellow, but we get to do so as residents here. Being a resident in oral and maxillofacial surgery is the best career choice I could have made. And I say that coming from a place where I've spent time on multiple other subspecialties rotating. You know, you get questions throughout those times of, well, would you consider switching? And my answer was always no. Even not being on my own service, OMS, I knew that oral and maxillofacial surgery was a very fruitful experience. Now I say that doesn't mean that I haven't put a lot of time in. There's been plenty of times where I've spent early mornings. There's been plenty of times where I've been here for late nights. But all of those experiences have been fruitful. I feel up to this point like I am competent at the level that I'm at, and I know for certain that when I finish this program, I'm going to be a competent oral and maxillofacial surgeon. A good oral and maxillofacial surgery resident is first off dependent. And going alongside that, being dependent also goes with being honest. I think the end of the day, what you judge a person, and especially a doctor who's going to be treating someone that you know, is would you let your spouse, your mother, your father, your brother be treated by that person? If you can tell yourself yes, then I think then you have a good resident, no matter what field you are, but especially in oral and maxillofacial surgery where we are subspecialists. A typical week here at UT Health San Antonio for a resident, at least at the upper level position, is one where you spend 1 week in the operating room and your primary responsibility is to focus on treating both those patients that are brought in as outpatients, those patients who have been brought in for trauma or infection, as well as new consults. And so your primary focus is to work and see those patients. The other weeks where we're not in the operating room, we spend time here in our clinic. Now in our clinic, we see patients that are both referred to us from private doctors as well as patients who just come in as referrals from here within our own clinics. And so we're planning those patients for extractions, for implant placement, for sinus lifts, all of the things that they need to make themselves feel healthier and get their mouths to a healthier state.
The technologies available to us at this residency training program are second to none. We make sure that our residents are always on the leading edge of technology, whether it's our XNav, the navigated 3D implant system, or whether it's virtual surgical planning.
Dental alveolar implant placement, we're using XNav technology, which allows us to both plan and place implants with surgical precision as determined by a computer system outside of even our own hands. For orthodontic surgery, we're using, and as well as reconstruction, we're using both virtual surgical planning for both of those types of surgeries, which again allows us to be precise, accurate, and efficient in the operating room.
I'm currently a third-year resident in this program, which is our intern year. I'm originally from Boston, Massachusetts, which is very far away from here, but it's been a really excellent change for me. There were multiple different things that played into my decision for me to come so far away for residency, one of which was the relationship between the faculty and the residents. It's palpable when you come in the room. You can feel that it's a genuine relationship, and that was very important to me. The other important thing to me was that there were other females in this program. Females are underrepresented in oral surgery, and this program really strives to take not just females in general, but qualified females, so it's been a really excellent experience for me. The scope here is very broad. It was the broadest scope of any program that I interviewed at or even looked at. We do everything from trauma to dento-alveolar, craniofacial, TMJ, orthognathic, anything you can think of in the scope of oral surgery, we're involved in. Even in our El Paso rotation, in our 6th year, we're exposed to head and neck microvascular surgery, which was a new, exciting opportunity for us here as well. So for me, I knew that anything that I did here, I would be able to go out, graduate, and practice in any aspect of oral surgery that I wanted and feel comfortable and prepared. Our interaction with our faculty here, I think, is what makes our program really strong. We not only have a collegial relationship with them inside of work, but we also have, a social and a friend relationship with them outside of work as well. It's not uncommon for us to have, barbecues with our faculty, go to dinner. They truly support us both inside and outside of the hospital, which I don't think you find everywhere, and it's something that I really value here.
What I like about working here in OMS is that it's so many different facets to OMS. Every day is something different. Every day is something brand new. And that's what I like about it. It's never boring. It's always exciting. The relationship between the residents and the staff is great. We're here to help them transition into this program. And once we're here for questions, here to make them comfortable. And we're all like a unique little family. We're here, just for anything that they need, we're here for that, to help them be more comfortable and get acclimated into the program. The resident growth is amazing to see. They come in, they're timid, they're scared, but the more comfortable they become, and we help them do that, the growth period from the 1st year to the 3rd year, 5th and 6th year, they start to open up. They become more comfortable doing certain procedures. They only call on faculty when they absolutely necessarily need to. They become more confident within themselves. So I love to see the newbie to the confident oral surgery resident. I'm getting to go out into the world and be on my own. I don't need the faculty help, but I love to see their growth, how they just become the oral surgeon.